Good afternoon, everyone. I'm Dr. Avania Bangalee. I'm from Wits RHI, based at the University of Witwatersrand in Johannesburg in South Africa. And I'll be presenting a poster entitled Sex Workers and the Pap Test, Abnormal Cervical Cytology Patterns in a Cohort of Unvaccinated Sex Workers attending an HIV-Dedicated health center in Johannesburg, South Africa. So cervical cancer is the second most common cancer and the leading cause of cancer-related deaths amongst South African women. Studies suggest that sex workers, especially those living with HIV, may be at heightened risk for cervical cancer compared to the general population. And despite national recommendations for early screening using a Pap test, there is only a 20% uptake of cervical cancer screening services in South Africa. So this has resulted in a paucity of data, especially in vulnerable women living with HIV. Therefore, we conducted a retrospective review of routine data that was collected at a USAID-funded sex worker-dedicated health center in Johannesburg between June 2019 to September 2022. Cervical cancer screening was performed by our professional nurses using the liquid-based cytology method. Cytological examination was conducted at the National Health Laboratory Service using the Bethesda system for reporting, and data were analyzed using Stata. So our results showed a cervical screening uptake among sex workers that was very low, at 4%. Satisfactory Pap tests from 104 women were included in the analysis. The median age was 34 years, with an average of 3 years in sex work. Most sex workers, that is 71%, were actually HIV positive in this cohort, and many reported consistent condom use with their male clients. In terms of the precursor lesions that were reported, these were present in 39%, and the most common precursor lesions that were reported at 44% was atypical cells, cannot exclude high-grade intraepithelial lesion, and in 42%, low-grade squamous intraepithelial lesion. The high-grade squamous epithelial lesions were reported in only 12% of reports. There were no squamous cell carcinomas or glandular changes that were reported. In conclusion, the prevalence of cervical cancer precursor lesions in this cohort of mostly HIV-positive sex workers was higher than the range reported for African women at 5 to 30%, with a very low screening uptake in our cohort. Alternative approaches such as self-screening, looking at HPV DNA methods, and an expanded vaccination strategy to reach key populations in South Africa is desirable. Thank you.